Youth was a nurse, married David and reared a family of 8. Went back to work in the nursing field. Then she branched out into the social field, and I think it was there that she realised there was a need for something more than just what we had then. She did her BA and her Masters in social work, and I think currently she's studying for a PhD in palliative care. I don't know how she finds time, but that's her claim anyhow, or her aim. Now, when she was, as I say, working in the field of social science, or social welfare, she envisaged the need for this foundation. Now, she worked very hard to establish it, and she established it in 2009, I think it was, and that dream is being realised tonight with the launching, so I call on Julianne, the CEO, to address you.
Isn't this amazing, hey? As I said, just want to welcome you here, and I really don't have 15 pages, so some of you would not believe me about that, would you?
No, not a chance.
And thank you, Rob, that was really lovely, very kind of you. But first of all, we want to respectfully acknowledge the past and present elders of this land and pay our respects to the traditional custodians. I think that's really important. And in this area, I feel we work with a lot of Indigenous people across the region, and you've really come to realise just how much we have in common when we're working with people at end of life. And so some of the conversations we're having with Aboriginal and Indigenous people is that, you know, there's that sense of coming home, of family, and all those things that we have in common, very, very starkly at end of life. So we've got a lot to work with, and we're doing a lot more work with the Aboriginal community, which is wonderful. So, as I said, thank you for coming here tonight. I really feel quite humbled and honoured, and I still can't, I don't like the title CEO. I think it really is a terrible thing, really. But you know, it's just wonderful. It really is great. So I've got a bit about Amaranth, what we are, what it means, because I'm sure you're all wondering what the word means, and where we started. And I've got a few people I really, really must thank, so bear with me while I go through all those thank yous. And I'm not mentioning all the children by name, except by number. So we've been operating here in Corowa since 2009. Are you people okay behind? Yeah? You look good. I'll tell you something funny. I bought this dress the other day. I've always wanted a little black dress, and none of them look really good on really short people. So I found one the other day, and I said to my two beautiful daughters last night, sorry, move on. And Maddie said, Mum, you look tall and thin. And I thought, oh, it's a magic dress.
That was Brady.
That was Brady, wasn't it? Sorry about that, digressing. So we've been here in Corowa since 2009. We were across the road behind the Tourist Information Centre in a tiny little office, and we all squeezed in. And we did a lot of good work there. There was a lot of noise, a lot of conversation, but it was a lot of good work. And that's where a lot of the impetus to start this came from. We found out that we were too small one day when I was counselling a lady and had to take her down to Brock's Cafe. And it wasn't terribly appropriate, and I thought, no, I can't keep doing this. So we're really lucky, and this house just became available for rental, so we're only renting this. I would love to buy it, but at the moment we probably need to pass the hat around to do that. So moving here has actually given us a permanent presence and a real focus, and I think that's really important. And it gives us a sense of a space. And a lot of people have said when they walk in the door that they do get a sense of something when they come here, and I think that's so true. So to begin, I want to thank quite a few people, so bear with me, that have really supported me from the beginning. But first of all, I want to thank my father, who can't be here tonight. Dad's really unwell and has gone downhill a bit in the last few months, and he's got terminal prostate cancer. And but Dad, and also my brother Greg, wherever he is at the moment. Greg. He doesn't have a number, but he's my baby brother. And Dad and Greg, I went home one day back in 2008 and said to them, look, I really want to start a foundation. And to their credit, they didn't flinch. They just said, what do we need to do? And so with their help, we actually wrote the Constitution. Have you ever written a Constitution? It's not easy, it's really difficult. And also David Potts from Potts and Snelly. David was really great in helping us with a lot of that, you know, establishment stuff, so it was great. And Greg also gave us the first few dollars that we needed to employ someone to actually answer the phone, which was great. And so that's been the start. And from there we got a wonderful government grant that allowed us to actually expand and put on other staff and set up centres right across the region. So it's been quite a journey. So really, you know, thanking Dad and Greg is actually pivotal to the work we're doing. The other people I want to thank are also my husband, David, who doesn't mind when dinner's at 9. Well, he hasn't said it anyway. And also my children, that are just really remarkable and amazing. And I've really got to thank too my two younger ones, who I was really home a lot more with my older children, the first 5 or 6. And these two little ones are really remarkable. And, you know, they cook, they wash, they bring washing in. They're really, you do. And, and really, I couldn't do this work without such amazing children, because they really are, they're just fabulous. And they also come in here, and Peter mows the lawns, and, you know, Maddie folds things, and look, it's just great, really wonderful, so I couldn't do it without them. And also my older son, Liam, who's a wonderful chef, and he cooks for me most Thursdays at the RSL. So from our humble beginnings of just, you know, myself and an office manager over in there, we've now got, I've got to look here because I've got to remind myself, 5 social workers, 2 full-time, 2 part-time, and 1 wonderful girl who works nearly full-time but in a voluntary capacity, and she's just remarkable. And our office manager, Gail, I couldn't function without Gail, so Gail, thank you. And thank you to John for letting her be here 90% of the time. And also, I'm sure he's learned how to cook and wash and clean, which is lovely. We've also got a community development worker that can't be here tonight, and she's an accredited dietitian and lives in Griffiths, and she'd love to be here but can't. And we're lucky to have her wonderful skills in working with communities. We also have 4 volunteers that are working almost full-time for us as well, and it's just remarkable. And there's one here from Cootamundra, Gail Haynes, who's done some remarkable work across Cootamundra to help us establish our presence up there as well. And over the summer holidays, we had Stephanie Whyte, my daughter, who's a 4th-year speech pathologist and did a dementia palliative care project and was really remarkable. And she's also now contributing to our newsletter with speech pathology things about oral hygiene and dysphagia for people who are dying. And that's really remarkable. And we've had an occupational therapy student here looking at the equipment needs and writing us a resource. So I just think it's amazing, just the support we've had from people. So I thanked my family. 2 other important people that are here tonight that I want to thank are Tonya Timmerman and Maddie Dobson. Now they're from the Zonta Club up in Albury, and they really inspired me back in 2000 when they got the idea to start the carers accommodation in Albury. Now that was an idea of 2 really crazy women that thought that this would be really useful. And I was just so impressed with their passion and their drive, and they started me on the research in palliative care. So thank you, and I hope, you know, this room's really, this building actually, isn't it? It's going to be a reality. It'll be just marvellous. And then we'll come up and do some counselling. And I want to thank everybody here in Corowa. It's just wonderful, really wonderful. And the people we've worked with, and professionals and friends, it's just lovely. Thank you for sharing this night with us. I need to thank Rob Packer. Now Rob is wonderful. He's one of the inaugural board members. And poor old Robbie came into the office one day when we were across the road, and I said, Rob, I need a name for the foundation. You know, we thought about Banksia, you know, the flower or something. And he went home. Rob's a wordsmith, so he went home and actually, you know, looked up his, Googled it probably, and he came up with Amaranth. But he's also responsible for a lot of the day-to-day running, signing the checks, checking up on us, making sure we're safe, making sure we're good and we go home on time, and just checking that everything's, he's just wonderful, and we wouldn't be here without Rob. So thank you, Rob. I also want to thank Fiona, Senator Nash, for coming tonight. And I've spoken to Fiona a couple of times about the work we're doing, and tutor ear for over dinner. And so I really want to thank you so, so much. And having you here is a real gift. So thank you, Fiona, for believing in us and coming. It's really wonderful. And thank you, Fred. It was lovely, Fred, that you came and spoke so eloquently about Corowa and the show. It's really wonderful. The lights work. So Amaranth, what does it mean? Thank you, that's great. Okay, so the word comes from Greek amaranthos, and it refers to the never-fading flower. And if you go inside, we've actually got little things of amaranth seeds, and if you actually use your magnifying glass, you'll find them. They're tiny like a little mustard seed, so they're in there. And it relates to people living a full life, which does not end with a terminal diagnosis. No. And so what we work with people, and the reason why Amaranth is so important and never fading, is that we work with people around the sense of dignity, hope and meaning. And so that their memories of their living and their dying will last forever. It's about the footprint we leave on this earth, and I think that's so important. And to me, Amaranth stands for that. So what do we do? And a lot of people say we have no idea what you do. And what we do is really very broad. Social workers work differently to other mental health professionals. We're counsellors, but we're also advocates. We do research, we do policy, we do a whole range of things. It is what that person needs. So the definition of what social work do is we help people with their fit in society and with their environment. So if there are things that they struggle with, whether it's finances, accommodation, transport, whether it's food on the table, whether it's getting the family together, whether it's advanced care, whatever. A social worker needs to be able to find that with a good assessment and then be able to work through those steps to help a person, whatever they need. So our work is with people with a terminal illness or a life-limiting illness. And we'd like to work with people at diagnosis, not at end of life, because then you can actually really do some great work around hope and meaning and dignity and probably make their last days as comfortable and as easy as possible. So it's not just cancer, even though I'd love to thank the Cancer Network in Corowa for their beautiful tent, it was great, and a few good strong men to put it up. So it's for people with frailty, with dementia, with lung disease, heart disease, kidney disease, so anything, any illness, where you know that the treatment or the intent of treatment goes from cure to care. And that's where I think that was where an Amaranth social worker or a staff from here can be working with people. So we work really closely with the doctors and nurses and the other healthcare teams. And try and liaise and get a consistent message across so that that person perhaps has one person to liaise with, or that perhaps we get the team together so that the person feels well supported. All our social workers are accredited or working towards accreditation with Medicare. So our aim is once we run out of money with the grant, which is happening faster than I really would like to think about, we'll be able to offer, and we're starting to offer bulk billing services from people who can get a GP referral. And they're starting to come through thick and fast, which is lovely. And I think tonight we'll just get the message out to the public and to the doctors and the other health professionals that this is a sustainable service, that's not a project, that will go on for as long as we possibly can. We also offer a lot of support with grief and loss counselling and family work and therapy. And all those patients too can be bulk billed, which is really lovely. We work with suicide prevention. A lot of our families too talk about euthanasia, and so we try to put that into a context of a sense of hopelessness and despair, hope and meaning, and try to help people sort of think around that whole context of a hastened death. And these are things that I think are really important because so often we don't want to broach those subjects, and we like to think that this is something that we can handle. And I think it's really great. The thing that drives me too is that I firmly believe that how people die matters. And so often the institutionalised way we deal with people is just not what people really want. A lot of people say they want to be cared for at home. About 80% of people say they'd like to be cared for at home. About 20%, or as long as possible. They don't have to die at home, but stay at home as long as they can. But only about 20% of people achieve it. So if we can actually change that statistic a bit, so that more people can stay at home as long as they possibly can, cared for by the people that matter to them, in a place that's meaningful for them, then I think we've achieved our goals. So we like to do the good planning, start early, work with people, talk to them about advanced care planning. Advanced care planning is not just about resuscitation, it's also about what matters, what gives them hope and meaning, what values, how does that family want to work with them, what legacy they want to leave behind. All those things are conversations that have to be had. And if we can help a family have those conversations and then get those messages out to the rest of the family and their broader community, then that's what we want to do.